this video, we will discuss about various signs that are present in hyperthyroidism. It is one of the most frequently asked questions. Also, you can mention them in your exam to have an edge over the others. So, first of all, we'll discuss about the lid signs. Okay. Now, in lid signs, I want you to remember a mnemonic, a very easy mnemonic, which has a lot of names in it, I must say. So, just remember that Dabby, Rimples, Vaughan, Grove, vigorously, Enroth, Rosenbach, Guy Gifford to Boston with Kocher Riceman, who is a baddie. Okay. Just remember this much. Okay, just suppose there's some woman named as Dabby Rimple, her son named as Vaughan Grove. He vigorously enwrought, just taken in a sense, enrooted, and enrooted someone named as Rosenbach Gifford to a city, Boston, with Coaches Reisman, again a name, somebody who is a baddie. Suppose this is the man and this is the female, and there is another friend named as Coaches Reisman, who is a baddie. So now coming on to the extraction of these to actually get the signs. So yeah, the first one is the Dabby Rimple sign. So we will write Dabby Rimples sign. This is very characteristic lid lag. Okay. Then coming on to Vaughan. Then Vaughan graphe sign. This is basically lid lag of upper eyelid on downward gaze. Then groove sign, or sorry, grove sign. Okay. Now in grove sign, what you'll see is you'll see resistance. Okay. So resistance to pulling down the retracted upper eyelid. Then vigorous sign. Eyelid fullness or swelling. Then Enroth, basically Enroth's sign. Just remember by the E, we have edema of lower lid. Okay. Then after E, we have Rosenbach. So Rosenbach's sign. This is basically there are tremors, fine tremors of eyelid when closed. Then Gifford sign or Guy Fawkes sign. Difficulty in averting upper eyelid. Then Boston, so Boston sign, jerky, irregular movements of upper eyelid on downward gaze. Then we have Kocher, so Kocher sign. This is the very characteristic Kocher sign. In this, what we see is there is an increased lid retraction, so with visual fixation. So this is the one which is responsible for the characteristic staring look in hyperthyroidism. Okay. Then Kocher is done. Then Reisman. In this, what you do is you hear a brood heard over the closed eye with a stethoscope. Over the closed eye with stethoscope. Okay. Then the last one, a baddie. Okay, a baddie. It is also a sign. So a baddie's sign. A baddie is basically going to create vigorous movement. So just remember, a baddie sign is the spasm of levator superioris, palpebral superioris, of levator palpebral superioris plus retraction of upper eyelid. Okay, so this completes the lid signs. Okay, just remember, David Impulse won't grow vigorously and Roth, a person, a girl, his girlfriend, draws in Jyford to Boston with one more friend, that is Koch's Reisman. Koch Reisman is a person who is a baddie. Okay, now coming on to the another signs, the facial signs. So to remember facial signs, I want you to, you must be knowing. That Muslims, they plan a trip to Hajj. Okay, basically, Hajj is the journey that is called when they plan a trip to Mecca and Medina. So I want you to remember Hajj, but I want you to remember Hajj. Okay. Also like this, basically H then J J S S. Okay, I want you to remember this way. So by what I have, by H, what I have is Hertog's sign. In Hertog's sign, there is loss of lateral third of eyebrows. Loss of lateral third of eyebrows. Then, very characteristic, Joffro's sign. This is basically the absence of wrinkles or absence of creases on forehead when we are gazing upwards. Overhead on superior gaze or upward gaze. Okay. Then by another J, I want you to remember Jelinek's sign. Suppose there is some jelly and it is very dark in color. So what you will see is that there is, we can say that there is hyperpigmentation. Okay, so hyperpigmentation, pigmentation of superior eyelids. Then by S, you can remember steel Wag's sign. This is very characteristic of hyperthyroidism. Okay. Um, yeah. So in steel Wag's sign, what you see is there is incomplete and infrequent blinking or winking. Then we have one S left. So by another S, we have Centon's sign. Centon's sign. In this, there is delayed forehead wrinkling on superior gaze. Just remember, the saints, they like to do things slowly. So they have, suppose they have a hyperthyroidism, in which you will see that there is delayed forehead wrinkling. Now coming on to the extraocular muscle signs. Okay, the third category. In this, I want you to remember a person named as Mobius Gendrasic. Now this Mobius Gendrasic, he does ballet, and this ballet sucks. It's not good at all. Okay, just remember this way. There's a Mobius Gendrasic who does ballet, and his ballet sucks. Okay, so Mobius sign. So in Mobius sign, what there is an inability. This is very characteristic sign. Inability to converge. Okay, then the Gendrasic. Okay, so Gendrasic sign. In this, what you will see is there is the limitation of abduction and rotation of eyeballs. Then ballet sign, there is restriction of one or more extraocular muscles. Then sucks, so sucker sign, poor fixation on abduction. Okay. Now, after extraocular muscles, you can remember about extraocular muscle signs. We can remember pupillary signs. Now, for pupillary signs, again, we have some easy mnemonic. So, just think of a pup who loves to wear CK clothes. Okay, just this Calvin Klein clothes. Okay, so pup is for pupillary. Okay, so loves for Loeys sign. Loeys sign. In this, what you will see is there is mydriasis with instillation of lower concentration of adrenaline. Now by C, remember there is Cohen's sign. Now in Cohen's sign, by C, just remember constriction and Cohen. So basically there is jerky pupillary constriction to light. By K, remember Nee's sign. There is the unequal dilatation of pupil in dim light. Okay. Now coming on to others, in other signs, just remember GPS. Okay, so gold Zeher's sign. In this, what we see is that there is deep injection of bulbar conjunctiva. So basically, the lower thing goes deep in. Okay, so then by P we have Payne's Trosse sign. Now Trosse is a word which we have read in one more lesion. In this, what we see is there is globe luxation. Trosse we have read in tetanus. Okay, and by S we have Sattler sign. In this, there is increased intraocular pressure on upward gaze. Okay, now I'll just sum up all so that you can easily remember. All right, so first of all, in lit signs, okay, just remember there's a mother named as Dabby Dimple. Her son is Von Grove, and he has vigorously enrooted or enwrathed a girl named as Rosenbach Chyford to Boston with Coacher Reisman, who is a baddie. So Dabby Dimple's sign is basically lid lag. Then Von is basically the lid lag of the upper eyelid on the downward gaze. Then Grove is basically restriction or resistance to the pulling down of retracted upper eyelid. Vigorous sign is basically fullness of the eyes or the swelling. Then Enroth sign or Enroth sign, yes, EE edema of the lower lid. Rosenbach stands for the tremors that happen on eyelids when they're closed. Gifford stands for there is difficulty in averting the upper eyelid. Then Boston stands for that there are jerky irregular movements of the upper eyelid on the downward gaze. Then Kocher sign, staring gaze. Reisman is basically you can feel the stethoscope. Yeah, you can feel the brutes over the closed eye during by stethoscope. A baddie is basically going to cause spasm. So spasm of levator palpebrae superioris, and there is retraction of the upper eyelid. Then coming on to the facial signs. For facial signs, just remember the journey of Muslims to Mecca and Medina. So it is called as Hajj. So just remember by the second alphabet it is two times, and then the third one is also two times. So by H what you have is Hertog sign. In this there is a lateral third of the eyelid eyebrows is lost. Then Joffre sign, very characteristic, no creases on the forehead when the person is doing an upward gaze. Then Jelinek sign, Jelinek jelly, so hyperpigmentation of the superior eyelids. Steel wax sign, very characteristic, there is incomplete and infrequent blinking often. Then Centon sign, in Centon sign what we see is there is suppose there are saints and they like to do things in slow manner, so there is delayed forehead wrinkling. Okay, then coming on to the another one, which is the Mobius sign. So, sorry, in the muscles. In muscle sign, just remember there's a person who is Mobius Gendrosic and he does ballet. And that ballet sucks. So Mobius sign stands for the inability to converge. Gendrosic sign is basically when there is limitation to the abduction and the rotation of the eyeballs. Now he does ballet. So ballet sign is basically when there is restriction of the one or more extraocular muscles. Then we have sucker. So sucker sign is basically there is a limitation of the fixation during abduction. Then pupillary signs, there's a pup who loves CK. So Loewy's sign is basically mydriasis with the installation of the low concentration of adrenaline. Then is the Coven sign is for the C constriction, jerky pupillary constriction on to the light. Knee sign stands for unequal dilatation of the pupil to the light, dim light. Now other signs, remember GPS. So golden Zeher sign, in this what we see is there is a deep injection of the bulbar conjunctiva. Also then Payne's Trosse sign, globe luxation. Sattler sign, that is there is an increase in the intraocular pressure on upward gaze. So this completes the signs which are usually seen in hyperthyroidism. I hope I made them easy for you. Just remember the mnemonics and it's easy. Thanks for watching.